What if some kids who we thought had ADHD were actually experiencing the effects of addiction to technology? Hello and welcome to the Dr. Suzette Glasner Podcast. If there's one thing that the recent verdict against Google and Meta in the landmark Los Angeles-based trial surrounding social media addiction brought to the forefront, it's this observation that has actually been very well documented across studies worldwide. Kids and adults are having a harder time maintaining focus, sitting still, and disengaging from screens. And increasingly, this is being labeled as ADHD. Mel Robbins reflects on the importance of recognizing the signs of ADHD and getting it diagnosed as early on as possible, particularly among girls, because it presents differently in girls than boys. And this is largely based on her own experience of having been diagnosed with ADHD in her late 40s.
Girls, on the other hand, don't start displaying symptoms until about the age of 12. And the symptoms are very different. Girls become inattentive, but in a kind of daydreaming fashion. They become a little bit more disorganized, and they aim all of this back at themselves.
But here's what Mel is missing, and it's actually really important. ADHD and technology addiction can look very similar. Addiction to certain types of technology is actually more common in girls than boys. So we also have those gender differences that we see in ADHD in the way that technology addiction can present. So the question becomes, which are we overlooking, ADHD or technology addiction? Many would argue that we are overdiagnosing ADHD. You probably heard that at dinner tables. And if you're wondering what the science says about this, there was a review of over 300 published studies that found that indeed ADHD is both overdiagnosed and overtreated in children and adolescents, with a tendency to place kids who are exhibiting what we would call mild or subclinical symptoms that don't quite meet the threshold for what we would consider diagnostic. Those kids are increasingly being placed in that diagnostic category when they actually don't belong there. On the other hand, while we have ADHD being overdiagnosed, technology addiction is being underdiagnosed. Part of the reason for that is that technology is so baked into our lives, our children's lives, the way that our children learn, the mechanisms for teaching at school. So because constant engagement with technology is so normalized in our society, it's actually not easy to spot when technology use has gone off the rails and become excessive. And that's part of the reason that we underdiagnose this condition. So the bottom line is that research suggests that excessive technology use, what some are now calling digital addiction, can actually change the brain in ways that look a lot like ADHD. So today I want to break this down in a couple of parts. The first is what tech addiction is doing to the brain or to the developing brain that is mirroring what we see in ADHD, how it can mimic or even worsen ADHD symptoms, and then importantly, what we can do about it, both for kids and adults. So let's start with what technology is doing to the brain. There's a growing body of research that shows that digital addiction is not just a behavioral issue, it is a brain issue. There are multiple studies that have shown a link between extensive screen time and symptoms of ADHD. So there was a recent survey of adolescents that was longitudinal, meaning that they follow them over time. And that really gets at the chicken egg question of what came first. They started with kind of a blank slate, kids who do not have a diagnosis of ADHD, and just following them over 2 years. They evaluated their use of technology, and what they found was that use of technology could play a role in the development of ADHD, because they found that the kids who used digital devices more frequently were at greater risk of having symptoms of ADHD 2 years later. The conclusion is that digital media use could play a role in ADHD symptom development. And the primary symptoms of ADHD are inattention, right? So being distractible or having trouble organizing oneself, and hyperactivity or impulsivity. So having a hard time waiting, interrupting other people, being restless. And here's how modern devices can cause these kinds of symptoms. Think about notifications. They immediately notify us when we have a new text message, we have a social media post that we might want to look at, a video game play invitation. That draws your attention away from tasks that you need to focus on. We're in this world where we're very frequently distracted and very frequently multitasking. And for a developing brain, that could actually disrupt the normative development of sustained attention and organizational skills. The other thing is that these digital platforms and digital apps and devices and experiences, they provide this instantaneous access to very stimulating experiences and very rapid feedback. You post something, people like it. You text someone, they text you back. We're waiting for digital notifications a lot more than we probably realize. And we want them very quickly because that's what we've become accustomed to. People who do this with great frequency, so these are sort of our high frequency digital users, they become accustomed to that rapid feedback, and that can actually disrupt the development of impulse control and patience, two very important functions in daily living as we move into adulthood. There's also neuroimaging studies that have found that digital overuse in kids and adolescents is also associated with changes in your brain's structure and functioning. This is particularly notable in the prefrontal cortex. And that's really important because the prefrontal cortex is responsible for a lot of important controls on our thought processes and our behaviors. That prefrontal cortex is regulating our attention, impulse control, decision making, and emotional regulation. In other words, exactly the functions that are impaired in ADHD. Another observation is that longer screen time was associated with lower cortical volume. The brains of kids who are engaging in screen use excessively are actually smaller than those who are using it less frequently. And that in turn is linked to more severe ADHD symptoms. Cortical volume, or the weight of your cortex, may potentially explain, or at least partially explain, that relationship between screen use and some of these ADHD symptoms that we're seeing. So what that actually means is that longer screen exposure contributes to delayed brain development. One other observation is that our different brain regions are connected and they communicate with one another. There is evidence of disrupted connectivity between brain regions, and that means that the brain is working less efficiently overall. The bottom line is that compulsive use of technology can make our brains smaller and slower to process information. Why this looks like ADHD. So let's connect this to ADHD. Clinically, the overlap is very striking. Both ADHD and overuse of technology can look like someone who's distractible, who can't sustain their attention, who is impulsive, and has a hard time completing things. But the key difference is that ADHD is a syndrome with known risk factors. People often need treatment over the longer term for ADHD, starting in childhood and continuing into adulthood, and really can benefit from ongoing management for this disorder. Technology-related attention problems, on the other hand, can be learned, and potentially they can be reversed with a change in habits around technology use. So here's what it might look like in a 15-year-old, for example, someone who's maybe diagnosed with ADHD and maybe even taking medication but still struggling. They might describe being unable to focus on schoolwork for more than a few minutes, but they could spend 6 hours straight gaming. And that contrast is important. So The brain is essentially trained to expect constant stimulation and reward. And that's what digital environments do. They train the brain towards constant novelty, rapid switching between different tasks and different sources of stimuli and stimulation, and immediate reward. And over time, slower tasks that are very important to being successful and happy and fulfilled, like reading, doing homework, or even having a conversation, can seem really boring and even intolerable. What this 15-year-old kid might actually need is just to reduce gaming and rebuild sort of other routines and replace it with some other rewarding, healthy activities. And in doing so, we would expect to see a shift in this kid's ability to focus, especially off screens. So sometimes, of course, we're seeing true ADHD that exists out there in kids, and it's important to diagnose and identify and treat. But sometimes we're seeing a brain that's been conditioned by excessive technology use, and the importance is recognizing the difference and even looking for the difference. The third part that I want to talk about is the addiction piece. Technology addiction is hard for some people to wrap their minds around because we're not putting something inside of our bodies, but it is activating our brain's reward system in ways that are immediate, repeatable, and hard to compete with. So in the mid-1990s, the term internet addiction was first used in the medical literature, and it's really not unlike other addictions in the behavior patterns that lead us to diagnose it. You're doing something with a lot of your time, it's starting to become your focus, detracting from your focus on other things that are important. It's starting to impede and impair your performance in other areas of life, including work or school or important relationships, and you keep on doing it compulsively anyway. That's what we see with addiction to drugs and alcohol. It's the same behavioral pattern that we're seeing in relation to technology. And you crave it. When you don't have it, you crave it. There is a documented state of withdrawal that people go into when they are using technology excessively and then it's taken away. We now have a few forms of technology addiction and that are recognized in our diagnostic system. One is internet gaming disorder. The other is still kind of a work in progress to define, but it's referred to as problematic use of social media. And I do have an episode on problematic use of social media as it relates to the Google and Meta trial. You should check it out if you want to have a deeper understanding of what that looks like, as well as what the nature of the case against Google and Meta was and why they were claiming that it was producing social media addiction in young people. So girls are more likely to have addictive behaviors around social media, and boys, as you might imagine, are more likely to be diagnosed with internet gaming disorders. Now, this isn't just kids, though. This compulsive use of technology is something we see in adults as well. I've worked with adults who have gone through periods where they feel like they just can't focus on anything. And when we take a closer look at their routines, we see that they are checking their phones every 3 minutes, sometimes even more. And they're scrolling late into the night. They're constantly task switching. And even modest changes to their use of technology, the frequency of it, some of the guardrails and boundaries they place on it, those can lead to changes in one's ability to focus, sustain attention, and get things done. And fast forward to if you have an internet gaming disorder, or if you have addictive behavior patterns around your phone or social media, effective treatments do help people with attention and emotional regulation, the very things that are impaired or negatively impacted by excessive use of phones and social media. When addiction develops over time, your brain learns a certain sequence. You're uncomfortable or you're bored, you reach for your device. Does anyone who's listening to this actually stand in lines now at the grocery store or at the bank or wherever you go and just stand there? Or do you pull out your phone and do something? We've been conditioned to interact with our devices at every free moment when there's nothing else going on, right? So we develop this pattern where we experience discomfort or boredom, reach for the device, and then get immediate relief. And then we just keep on repeating that. And eventually, the brain prefers that loop to doing other things. So now coming back to Mel Robbins, whose ADHD was identified when she was in her late 40s. One of her important messages is about getting properly diagnosed.
If you don't get properly diagnosed and treated, and by treated, I mean the whole array of things that you can do, whether you're talking about medication or just the different habits that you can have or systems that you can develop to support yourself. If you don't get properly tested and you don't address it, do you know what the number one thing that happens? You develop anxiety.
Now, I agree with Mel 100% about the importance of knowing what it is that you're dealing with, because that is your guide to your next steps. We now have this other important consideration for those same symptoms, though, and that has come as we're learning more about how technology addiction can present, how it presents differently in men and women, girls and boys, how it can look so similar to ADHD. We just need to do a better job at differentiating the two and considering the technology addiction alternative explanation for some of these types of symptoms that we observe so frequently in our youth. The next question is, what can we do about it? What actually helps? So we can't eliminate technology, right? So the goal then becomes to restore our sense of control over our use of technology. And here are some of the most effective research-supported strategies for that. First of all, if you think that you have a problem related to compulsive use of technology, you can't put it down, you're experiencing withdrawal symptoms or discomfort when you don't have your phone or your device or when you're not on technology, if that's happening to you or somebody you care about, seek professional help. This is part of that whole diagnostic process that we're talking about. But things that you can do both with a professional and on your own potentially, the first is mindfulness meditation training. Mindfulness is known to improve attention and focus, one's ability to self-reflect, to pay attention to what's happening in their body. Those are attentional skills. They also have the benefit of improving emotional regulation and mental health. So mindfulness training, number one. Number two, have some digital free zones at home. Some obvious ones that you can try for are the dining table. Just keep devices off of the table. You make that a rule in your home, and it's just a black and white rule. It gives you a break and enables you to have some of that in-person interaction that we very much need. Another one is the bedroom. Now, people have a hard time with this because what if the phone rings when they're sleeping? But particularly at night, because it can be disruptive to sleep, if you can make your bedroom a technology-free zone and you can put your devices in another room so your bedroom is just for sleep, that's another helpful strategy. The third is setting specific limits. So there are app trackers now that will monitor and limit your daily screen time and that of your children. You should look into that just to have clear, predictable boundaries around your use and also being very intentional about how much you are using technology. The fourth is what's been increasingly referred to as digital detox. If you can imagine it, have a digital-free day, a digital-free 24 hours. If that sounds like too much, try half a day, try even an hour that you designate that you're intentionally off of devices so that you can have that in-person connection with whatever it is you're doing, whether you're doing something by yourself, you're cooking something, you're doing something, you're reading something, you're not going to be interrupted by technology. It's just going to help you feel a little bit more grounded and less dependent, and then also to connect with other people in your family or in your environment. Another important aspect of this is what you model to your family. There's this issue of digital dependency and kids is in every household. It's something we're all contending with, but a lot of it starts with what you're modeling to your kids. So if you never put your device down, you cannot expect them to want to put a device down. Then rebuilding alternative rewards is so powerful. Get outside. Leave the device in the car or somewhere else and exercise, have some social interaction, some creative activities. These matter more than we actually think. They're very vital to our mental health and our physical health, obviously. And then finally, coming back to this idea of professional help, though we're still learning more about what the most effective treatments are for internet gaming disorder and other technology dependencies, the same types of therapies that are very effective for alcohol and other substance addictions are our go-to treatments for internet-related disorders or technology addiction. There are even medications that can help with impulse control. Don't hesitate to seek out help. And especially if you're suspecting in yourself or in someone you care about a potential diagnosis of ADHD, that would be a great time to ask the question to a trained mental health professional, could we consider how technology use may be playing a role? Because there are people who have overlapping ADHD and technology addiction. We actually see that co-occur frequently. So the two might be occurring at the same time in the same person and both need to be treated, but we don't want to mistake one for the other because the treatment approaches may be very different. And treating someone for ADHD who doesn't have it, particularly if you go down the route of medication, does have the potential to introduce harms to a person. Very important to fully understand what the diagnosis is. I hope that you learned something valuable today, and I look forward to seeing you next time.